Hello everyone, I am Dr. Dilon. Today I am going to talk about one of the most common topic in our clinical practice, that is lipid profile. We suggest lipid profile to some people to do because of their age, because of their family history, because of their complaint, and we have to take measures from the abnormalities. So we have to educate the patients regarding the lipid profile abnormality, as well as it's our own responsibility and it's their rights to know what abnormalities they're having. So if you see the lipid profile, there are some factors and components, and what are those that we are going to discuss today. So if you see a lipid profile, there will be total cholesterol, there will be HDL, there will be LDL, there will be triglyceride and cholesterol HDL ratio. What are those? We will see one by one. Total cholesterol, it is a cholesterol produced from the liver from our diet. So whatever the fat, whatever the oil that we eat, the liver will take that and will produce cholesterol. Why cholesterol is important to our body? The cholesterol which is produced from the liver will be utilized for the bile formation, for the hormone formation, for the structural wall. If you see the cell wall, it is one of the structure of the cell wall. So for that thing, we need only a minimal amount of cholesterol. But if you eat more and more and fat and oil, it will convert cholesterol and it will utilize only a minimal amount of cholesterol for those benefits, and the remaining will be deposited in the body and will cause harm to the body, especially heart attack and etc., stroke and all. So this is the problem with our lifestyle and diet. We have to take minimal amount of the fat or oil stuffs. So the cholesterol which formed in our body will carry through the blood by a protein known as lipoprotein. Okay, depending on this lipoprotein, we classify them into two categories, that is LDL, HDL. Low density lipoprotein, and HDL stands for high density lipoprotein. LDL, we see the reports, total cholesterol, LDL. So we'll talk about LDL, HDL and all. LDL, it is low density lipoprotein and it is known as a bad cholesterol. Okay, what it does, it goes and deposits in the arterial wall and it damages the arterial wall and it forms a plaque that will lead to stroke and myocardial infarction. That's why it's very important to have a control over this LDL. HDL is a high density low lipoprotein cholesterol. It is very important to have a high HDL because the function of HDL is reduce the bad cholesterol from the arterial wall. It minimizes the formation of the deposition of the LDL, it minimizes the formation of the plaque. So that's why we advise patients to have a high HDL and low LDL. Here one question comes, whether to increase HDL is it easy or to reduce LDL is easy? Answer is reducing LDL is easy than making HDL high. So this is why we advise the patient diet control, do exercise, reduce LDL rather increase HDL, because it is easy to reduce LDL rather increasing HDL. And we will talk about the triglyceride. It is one of the main energy form in our body, energy source in our body. That also when we take more and more diets, that also will go and deposit in the hearts and all. It will cause some severe side effects and severe diseases. And we talk about cholesterol HDL ratio. We measure the cholesterol, we measure the HDL, and we make a ratio, and that ratio should be below than 3.5:1 because this ratio is important to predict heart disease. So that's why we always have to keep below 3.5:1. Okay, so now we know the lipid profile and its components and what are those. Okay, now we saw that, and if there are any abnormalities, we are gonna start to treat the patient. Are we going to start immediately drug? No. We have to educate the patient, we have to counsel them, we have to make a lifestyle modification with exercise, diet and all. Then we can go for the pharmacological management. So in that basis, in our diet, there are some particular fats we including. Okay, we are including particular. What are those type of fats that we are taking daily? If we think about that, there are nearly 4-5 types of fats are there. The first one is, obviously we are advising patient to reduce the dietary oil and all. So if we classify the fats that we are taking daily, the first one is it should be, or it may be, a trans fat, it may be a saturated fat, it may be polyunsaturated fat, or it may be monounsaturated fat, or it may be sterols. Okay, so trans, saturated fat, monounsaturated fat, polyunsaturated, nearly 5. Among these things which are bad, trans fat and saturated fats are bad. Okay, what do you mean by this trans fat? Usually these trans fat are man-made fats. These are really bad. They are, if you eat that, it will increase your LDL level and it causes serious heart problem. What are the examples for the trans fat? Vegetable oil and fast foods, cake, chocolates, and deep fries. These are the examples of trans fat. Avoid it. Second one is saturated fat. This is also bad. This is also will increase the LDL. What are the examples for saturated fat? Coconut oil, palm oil, and fatty meat and fats that we see in the meats. Then butter, ghee, condensed milk, and all. So these are the saturated fats. So avoid trans fat, avoid saturated fat, or take very minimally. Then we'll go for the monounsaturated fat and polyunsaturated. These two are very important and good for the body. Example for monounsaturated fats: olive oil, canola oil, avocado, and peanut oil, and most of the nuts have monounsaturated fat. These are good. These are good for heart. It can increase the HDL. Okay. And polyunsaturated fat, we classify them into omega-6, omega-3. Among this, omega-6, when you take that in a low dose, it can increase the HDL, it can reduce the LDL, but when you take it in a high dose, sometimes it can increase the LDL. So be cautious regarding omega-6. Omega-3 is good, that can increase the HDL. What are the examples of polyunsaturated fat? We can go for corn oil, or we can go for the soya oil, we can go for sunflower oil and seeds. Most of the seeds have this polyunsaturated fat. And lastly, we go for the sterols. Sterols, these will reduce the absorption of the cholesterol from the gut. So from the gut, it reduces the absorption. So it's one of the best thing that we have in the food. Example, most of the fruits, especially apple, avocado, and those things, and orange and all, and tomato, we can see in tomato, in corn oils, and in olive oil, we have sterols. So this is very important to have in our diet. So it will reduce the cholesterol that is absorbed from the gut. It can go to the feces. So these are the fats, daily fats we take. So now hopefully this video is helpful for you to identify and classify and analyze the components of the lipid profile. And after that, what are the fats daily that we are taking? It could be trans fat, it could be saturated fat, it could be polyunsaturated, it could be monounsaturated, it could be sterols. Among these, what we have to avoid? We have to avoid trans fat and saturated fat and take the other fats and live a good and healthy life. Go for exercise, go for brisk walking, take healthy vegetables and fruits, and hopefully this video is helpful, and we'll see you in next video. Thank you.